common in women, and it can occur in both men and women. But it's far from women though. Okay, so of breast cancer and form has helped create advanced diagnosis and treatment. Survival rate of breast cancer and number of associated with this disease is steadily declining, largely due to the factors such as early detection, a new personal permanent medical group in Maryland, USA. She is a native of Sierra Leone and graduated from the University of Florida College in both internal medicine at the Hopkins Hospital Clinics, Maryland, and in anesthesiology at the Rogers School of Medicine in New Jersey. She is skilled in clinical research, medical education, and immunology. She was voted as a top doctor by the Washingtonian magazine and indoctrinated as a member into the Continental Who is Who, a global prestigious forum that is dedicated to recognition of excellence in fields of professional work, including medicine. She is the founding member and CEO of ADAC Health and the ADAC Foundation. With great honor, can you please help me welcome our guest speaker, Dr. Kadia Bundu, as she enlightens us on the breast cancer awareness. Thank you for your audience.
Thank you very much, Ms. Karim, for that warm welcome. Dr. Bundu, you're welcome. The floor is all yours.
Well, thank you so much. Good ladies and gentlemen, and thank you, Khadija, for the introduction, and thank you to Ishmael for moderating this event today, and Al Hassan for connecting me with you guys. I am currently presenting from the state of Colorado. So we are about 9 hours behind. The time here now is 11 a.m. And I am presenting from my brother's house on the Army base, U.S. Army base. So as Khadija mentioned, I am also Kadia, another derivative from Khadija. And I have been practicing anesthesiology in the state of Maryland for about 7 years now. And in my practice, I get to take care of a lot of patients who are mostly coming in for breast cancer surgery. That often involves mastectomy, which is a complete removal of breast tissue, could be unilateral or bilateral mastectomy. The most common surgery though is the lumpectomy, which is just focusing to removing the mass itself and sparing the breast tissue. And then sometimes lymph nodes are also taken out. I also take care of patients who are coming in for breast reconstructive surgery after mastectomy so that the women can still feel beautiful when they've lost their breast. So often I would say in my field of work, even though these women are coming for cancer surgeries, there's hope. Why? Because of early detection. We have less incidence of the mastectomy and more of the lumpectomy. And I often also come across patients who are breast cancer survivors who are coming in for other types of surgeries, and they are 5-year, 10-year, or even more years out since their diagnosis, which shows that the survival rates are up, and all because of the effort and this initiative of awareness. So I would now like to actually start to share my slide of a presentation that I put together for your group tonight. And if the admin would allow me, I would ask to be able to share. So, Ishmael or Al Hassan, could you help me in terms of how I can proceed to share my screen?
I I think you can access the screen right now. You can just go to share screen and
Okay, so I'm going to go to share and I'm going to go to desktop. Mm, so let me start the presentation.
okay.
All right, can you guys see my screen?
Yeah, we can see the screen. It's clear.
Okay, great. So October is Breast Cancer Awareness Month, and this month has been identified um, as a month to promote breast cancer awareness globally since 1985. And it was just really a group of individuals, breast cancer survivors, pharmaceutical companies. I know you guys know now about AstraZeneca. Well, back in the um, early 90s, AstraZeneca came on board to try to focus on developing treatments, especially chemotherapy drugs to fight against breast cancer. So they joined in with the National Breast Cancer um, Organization, the American Cancer Society, and as well as the American Academy of Family Physicians to create a conversation and an awareness around this disease. Since then, the awareness has become global and all over the world. Companies have become involved. Research funding has increased, and the aim at the time to protect women through early diagnosis, mainly through mammography, has now evolved really into increasing survival, right? So some myths about breast cancer that we can all come together to try to debunk, whether in the Western world, in the United States or Russia, or even in Sierra Leone, is the number one myth that men do not get breast cancer. They do. The incident rate is very low. Um, I've had patients, not often, but men who have had breast cancer. Why? Because men also have breast tissue. And although less denser than women, those tissues can then develop into cancer cells. And if not treated or recognized early, can metastasize and can cause death. So men do get breast cancer. Not all lumps in the breast are cancer. We have some lumps that are just benign breast lumps that can be removed and there's no risk of reoccurrence. Breast cancer initially was thought to occur in postmenopausal women. That hasn't been the case as the years have gone by. We're seeing breast cancer in women as early as mid-30s, often without even a family history. So breast cancer can occur in women even younger than 50. And this has impacted the age at which screening occurs. People often think that if they live a healthy lifestyle, eat well, exercise, eliminate stress, that they would not be at risk for breast cancer, and that's not true, even though that can help. People think for patients who have breast cancer, they must have a family member who also had breast cancer, and that's not true. It can occur in any women as long as you have breast tissue. Believe it or not, there are some women who think that mammograms, because of the way they're performed, wherein they're crushing the breast together to be able to get the image, that can cause breast cancer or the propagation of the cancer itself. That's not true. There are women who think that taking herbal medication can cure breast cancer or even prevent it. I remember a patient who came in who was very wary of hospitals and doctors, and she only came into the hospital because she had lumps all over her skin, very tiny, small lumps. So she came to dermatology for evaluation, and when one of those lumps was biopsied, it turned out to be breast cancer that has spread all over her body. So she was very big on herbal medication and very wary and suspicious of, doctors and medicine in general. Obviously, in some places where we come from, people think that pastors and prayers can cure breast cancer. I believe in miracles, but I also believe that some of the miracles has been in the wisdom that has been given to scientists and physicians to create treatment and come up with diagnostic modalities to cure breast cancer, and that itself is a miracle. But definitely, if you know someone who thinks that if they have been diagnosed with breast cancer, that just going to their pastor would cure it, please advise them and talk to them to seek medical attention. And then some people just think breast cancer is a curse, which obviously is not the case. So those are some of the myths around breast cancer, which, the whole effort behind Breast Cancer Awareness Month is sometimes to debunk some of these perceptions. So this is a picture of the White House here in the United States. And this was in October, I believe 2019, when they lighted up the White House in pink in commemoration of breast cancer, and to stand in solidarity with the survivors and all the women who have died and those who will in their lifetime be diagnosed with breast cancer. So we see this a lot more, companies, organizations who are sort of just taking up that mantle to show their awareness and their support for breast cancer. And that alone has now caused breast cancer awareness to be one of the most popular cancers with awareness globally, because companies and organizations and groups like you are really promoting the month of October around the globe as Breast Cancer Awareness Month. So this graph is taken from the GlobalCom, from the WHO data, WHO data about the incidence of breast cancer. So this is the report coming in from the year 2020 alone. There are many, you know that there are multiple types of cancers, both in men and women, but breast cancer happens to be one of the leading causes of cancer among women. And last year alone, over 2 million women were diagnosed globally with breast cancer. And compared to colorectal cancer, for example, breast cancer mortality is only behind cardiovascular diseases such as heart attack and cardiac arrhythmias as cause of death. It's second only to that. So what's the mortality rate? The mortality rate as of now, this is just from the 2020 data, is about 6.9%. So it's below lung cancer, colorectal cancer, liver cancer, and stomach cancer. So a disease that has a high incidence rate, but a slightly lower mortality rate, that's really because of awareness, early detection, early treatment. This map is really just showing the incidence globally of breast cancer. So it is very surprising to see that breast cancer, although it's occurring in every country, both developing and underdeveloped countries, the incidence is more common in Western countries, especially the United States, Northern America, and Europe and Australia, which is the darker blue that you see. In Africa and Asia, the incidence rate is lower, but mortality is higher, and we'll discuss later why that is. And for now, like the country with the highest incidence rate of breast cancer, believe it or not, is Belgium. And many factors can play into that, but breast cancer really is a disease of the Western world, not just of a certain race group, because even for a woman coming from Africa and living in the United States or Europe for a time being, well, their incidence or risks for developing breast cancer will start increasing. So environmental factors definitely play a role, and most likely diagnosis as well. So October has been termed Pinktober because of the color pink and the pink ribbon, which was actually introduced by Estee Lauder in 1993 as the official symbol for the Breast Cancer Awareness Month. So you see pink all over, so we term it Pinktober. So what is the focus really of the awareness of this organization really in this movement? One is to educate the public about the causes of breast cancer, the prevention, and that's, it can be a preventable disease, especially death, really a preventable death. To focus on early diagnosis through screening, especially mammography and self-exams, treatment, the race for cure, and then also I added on their research funding because that has been huge. So let's focus on the cause, right? The causes of breast cancer, there's multiple. There's the inherited gene mutation, the BRCA1, which is the breast cancer gene 1, and the BRCA2 mutations that you often see in family members who, wherein there's a family history of multiple women being diagnosed with breast cancer, often in early stages, and often in an early age versus the rest of the population. The identification of this gene really has had a huge impact in the survival rate because once this gene was identified, then women could prophylactically take measures through mastectomy and hysterectomies and even oophorectomies, removal of the ovaries, to prevent the occurrence of cancer in themselves and their children. So we know of prominent women like Angelina Jolie, whose mother died of breast cancer, and she tested positive for the BRCA genes. And so a few years ago, Angelina Jolie went ahead and had her breast removed, and as well as her uterus. So she was preemptively trying to prevent the occurrence of breast cancer in herself. A risk factor that was identified has been obesity, and not just for breast cancer, but in other types of cancers as well. Obesity usually means larger breast, denser breast tissue. Sometimes when women with larger breasts, it's hard for them to really notice through self-examinations, masses that could be developing. And even with mammography, women with denser breast tissues tend to have false negatives when they go for their mammograms. Smoking as well as alcohol consumption are those behaviors and practices that have come up as a cause for cancers and also in breast cancer. Especially, they did a study recently, and this was presented in one of the newspapers in Europe, in London, showing that women who tend to have a certain number of alcohol consumption per day or per week showed a higher risk for developing breast cancer. History of breast cancer. Most times women who develop breast cancer in one breast are at risk of developing breast cancer in the other breast. Exposure to radiation, especially radiation to the chest, radiation anywhere puts you at risk for breast cancer or for any cancer, but especially for radiation to the upper chest area. And then also physical inactivity. So the second focus for this awareness month is prevention. And that has really been driven by early detection. So like I mentioned, frequent self-examinations at home. If you are able as a female or a male to identify a mass that has not been there, identify the growth of that mass or the change in the size of that mass, inform your primary care doctor, then you could be referred for mammography and early detection. Lifestyle changes help for any disease, really, not just cancer, but cardiovascular disease, neurologic disease like stroke prevention, through exercise, healthy diet, minimizing alcohol consumption, and smoking cessation. So these are all if for all of you who are longing or looking forward to entering the medical profession or are already in the medical profession, these are practices that you could encourage your patients to do, which although I am an anesthesiologist, I often find myself counseling patients who are coming for surgery. If they're obese or if identified through their chart review that they have some risky behaviors, smoking, or heavy alcohol use, I try to educate them a bit about lifestyle changes needed because of the high correlation between these behaviors and cancer development later on in life. Genetic testing, especially for the BRCA1 and BRCA2 genes for family members who have a history of breast cancer. So in terms of diagnosis, it has been shown, as Khadija mentioned, that early detection saves lives. So one of the strongest push for the breast cancer awareness is for early diagnosis. So girls and women when they start developing breast tissue should be taught by their mothers or by their primary care doctors how to appropriately palpate their breast tissue for any abnormal or inconsistencies in the breast tissue, and also identifying lumps. It could be like an adenofibroma, or it could be, a cancer. But if we're not examining ourselves, then there's a chance that the identification of that mass could be done later, and our chances of survival, if it turns out to be cancer, could be decreased. So mammography has really been pushed by this organization for breast cancer awareness to start early. When women started showing up with breast cancer at the age of mid-30s, now they have changed the screening age to reflect that change in demographics. So I had my first mammogram at the age of 35. And regardless of family history or not, in the United States anyway, primary care doctors are being advised to recommend their or refer their patients for yearly mammogram. Once the mass obviously is identified, the woman is then referred to the radiologist for breast ultrasound. And then obviously that mass is biopsied. And if it comes out positive for cancer and then staging occurs through CT or MRI to see if the cancer had gone beyond its primary location and have invaded the lymph nodes or other organs. So a woman who is diagnosed with breast cancer goes through a series of steps in terms of the treatment, all to improve or give them the chance for cure. Once the biopsy shows that the mass is in fact breast cancer, they're coming in for surgical resection. And often this is when I get to interact with them, as I mentioned earlier, when they're coming for a lumpectomy or mastectomy. Afterwards, the oncologist will see them for chemotherapy. And then you have the radiation oncologist that will then try to radiate the area. This is not done very often anymore because it causes so much damage to the breast, and sometimes reconstruction is very difficult and impossible because of the radiation damage that's caused to the breast tissue or the chest area. For women who are lucky enough to be diagnosed early and receive lumpectomy, and which is a breast tissue sparing surgery, if they have hormone, if the breast cancers are positive for hormone receptors, it's a blessing because then there are drugs that specifically target those receptors to block them. So, for example, if the breast mass is biopsied and tested and stained for estrogen receptors and like the HER2 receptors, and if that's positive, then they could be placed on tamoxifen for life, which will block the receptor. And there's also other types of hormonal therapy like the aromatase inhibitors, which does not directly bind to the receptor, but it actually works to decrease estrogen production because estrogen is like a food for these cancer cells that have estrogen receptors on them. So if you decrease the level of estrogen in the women, then the cancer cells would tend to die or not develop. So all of this comes down to increasing the survival rate of the woman or the man. Early detection. This is the sole goal, the main goal and reason behind Breast Cancer Awareness Month. Early detection. For all women, starting at a young age, to let women know that we are all at risk for breast cancer. Some women are higher risk versus others, but we all need to be doing our self-examinations when we reach a certain age to make sure that we have had our first mammograms and then continue that every year. Because when the cancer is detected early, then intervention can start early on. The surgery is less invasive. Treatment can be also less invasive. The disease burden can be less and decreased, and your chances of survival goes up, right? Your quality of life also could be better compared to a lumpectomy that is done with lymph node sparing could save a woman from having to develop, edema of the arms, which can just increase their morbidity, or having to go through reconstructive surgery and having breast implants placed, which in itself is not very comfortable oftentimes and have its own risk factors. So early detection is not just for decreasing mortality, but also decreasing morbidity. So for all stages of breast cancer, from stage 1 to stage 5, the survival rate has gone up over 90%. It's one of the highest for cancer. And the reason behind this increased survival rate really is going to be depending on the aggressive nature of the cancer. I would like to note that in the United States, when they have compared women of African descent compared to Caucasian women or Asian women or Hispanic women, the women of African descent tend to have the more aggressive nature of cancer most of the time. Their cancer cells do not carry the hormone receptors like the estrogen receptors, which can then be treated with targeted receptor therapy, like the estrogen receptor blockers. Metastasis and metastatic location also matters in the survival. So for a woman who is diagnosed and the cancer has already progressed to the brain or to the lungs or to the spine, that's much different versus, you know, a cancer that remains localized to the breast tissue. And also response to treatment. There are different treatment modalities out there, including chemotherapy, but some women just cannot handle the treatment. They have to stop. Their dosages, the length of treatment has to be tailored to them. And of course, if you're not receiving the full dose and for the length of duration, for your cancer to go into remission, then the chances of reoccurrence increases. So what has this movement done over the years? Now that we are all aware of it, we all know that Breast Cancer Awareness Month changes lives. It impacts lives, and we even have students like you in Russia who are promoting this as part of your agenda for your organization, right, or your activity for this month. What has that done? Number one, it has moved. The movement has moved beyond the United States and has become global. So even in Africa, you would see women wearing pink, events being organized to increase awareness through education, removing the stigma, and really trying to recruit maybe physicians and surgeons who can go into that field to perform surgeries and also to be trained in reconstruction so that the quality of the survivor, the female survivor of breast cancer can remain the same, the quality of life can remain the same or be better than if they were not to receive that reconstructive surgery. So what has this movement done? It has increased the number of women receiving mammograms over the years, increased the number of breast cancer detection. And we're seeing that because the incidence rate of breast cancer diagnosis is actually going up, including in developing countries like Sierra Leone and in Asia. So if more women are being screened, then the chances are more are being diagnosed. And so that reflects then in the number of detection. Early detection obviously has then led to increased survival rates. And because of corporate involvement, you know, it is now very lucrative to any company to support breast cancer awareness. So that means that the funding for research has also gone up. And with funding increasing for research, new drugs can be developed and be introduced to the market, and other treatment modalities as well. Even the surgical approaches have improved for breast cancer treatment. So as I was saying before, breast cancer awareness now receives more media coverage than any other prevalent cancer, including prostate cancer, which is seen in men. So I would say that all of us here today, myself including, and all of you guys participating in this Zoom meeting, you've done so because you're part of the movement and you want to get involved in the fight in the race for a cure. Now, how we can do that is to continue to have open conversations, starting with our family members, our friends, right? Both abroad and in Africa for screening. Because as I was reading, in the United States, for example, 80% of breast cancers are diagnosed early, still stage 1 and stage 2. And that definitely impacts survival rate, right? Because of early intervention. But in countries where we are from, most of the time, when the women are diagnosed, they are diagnosed when they are already at stage 3 and stage 4, which are the late stages. And that's about 75% of breast cancer cases are diagnosed that late. And what does that mean? It means that the survival rate for those women is lower, even though the incidence is lower in those countries. The survival rate is lower compared to the Western countries because of that late diagnosis. So by having the conversations for self-examinations and pushing for mammography or mammograms to be available in our countries, then we can definitely turn that tide around and help to increase the number of early diagnoses in women for breast cancer. You can organize community activities around Inktober or October Breast Cancer Awareness Month. And by bringing that awareness to communities where you live, it opens up the conversation and will then definitely influence women and patients going in for screening and for diagnosis when they do notice some abnormality in their breast tissue. Or like myself, or, you know, there are some very wonderful physicians who have dedicated their lives, as well as scientists who have dedicated their life, perhaps for personal reasons. Perhaps they knew someone who, a loved one who died of breast cancer, a mother, a sister, or wife, and that influenced their decision to, you know, go into research to combat this disease. You could be a surgeon that does, you know, just general surgery. General surgeons are often the ones performing surgeries. Amazing plastic surgeons who do reconstructive.
But no, fine, not
Sorry. We have amazing plastic and reconstructive surgeons who are trained to reconstruct the breast when the breast tissue has been removed, so that the woman can look in the mirror and still feel good about herself, right? Not very long ago, so many mothers and wives, you know, when they had to have mastectomies, hide from their spouses or from their children, they've had their breast removed. It was a taboo. It was a source of shame. So these amazing surgeons really have helped to change that. Some women, believe it or not, used to refuse to get mastectomies because the breast was their identity as a woman, and they didn't want to walk around flat chested. So these men and women are now doing amazing work, you know, to still give a quality of life to these women. Radiation oncologists and medical oncologists are phenomenal. They are the ones that see the woman and the woman through the most difficult part of the process and the most challenging part, which is just, you know, going through the treatment. It's not easy. And then for those women who will lose the battle to breast cancer, there's a palliative care specialist. That's another field to go into, wherein you counsel them as they go through the end of life process. So that's the end of my presentation. I hope it has helped improve your level of awareness and knowledge about this disease and empowered you or even encouraged you to do more than what you're already doing, and to continue to observe this month every year and make it an event, a yearly event for your student organization, and to also perhaps be aware so that you can be an advocate for your family members and your community to bring in this awareness globally. Thank you for having me, and I will take any questions that you may have.
Thank you very much, Dr. Bundu, for such an informative and interesting presentation. I think from your presentation, you mentioned a lot of from a presentation. You mentioned about lumps in general, I think, and you talked about benign and also about malignancy. So I think most people here that not medically, I mean, that some might not be medical students, or I mean, they might not be medically inclined, will try to, they will want to know what's the difference between this benign and the malignant tumors.
So in simple terms, benign tumors are still just breast cells that have developed, whether during, genetic replication, they have developed abnormally. In our bodies, every day, our immune system is fighting cancer cells. Every day, our bodies, because of error in genetic translation and the replication of cells, some of those cells will be deemed as cancerous, right? But our immune system is so good at getting rid of it. Most of the time, we don't even notice. But every day, our immune systems are targeting these abnormal cells and getting rid of it. Unfortunately, some cells escape, the death, and they survive it, and then they divide and develop into abnormal cells. Now, some of those cells are, I would say, are weak, right? They are not very powerful, and they just develop into a clump of cells that restricted, they stay where they are. And they did not develop the ability to keep replicating and then also evading the immune system and then spreading outside of the location where they are. So we call those benign because they're benign because their risks, the threat to our life is low versus cancer cells are very smart. They have developed the ability to evade the immune system, but not only to evade the immune system, but to invade the vascular system and the lymphatic system, to then leave the location where they are and to spread to other parts of the body, establish themselves in new tissues and new organs, and then continue to divide. And really their goal is to cause death. So we call them malignant. These are the cells we are fighting against.
Okay, thank you very much. And also, one might, I mean, the origin of these tumors in the first place, and what are the parameters that actually determine, I mean, competent immune system, to give a complete response to the breast cancer?
Can you restate that statement again, that question again, please?
I was asking about the origin of the tumor. I mean, in general, the origin of the tumor. People might wonder, where does this tumor come from? Is it as a result of our lifestyle? Is it as a result of the food we eat? Things like that. And I was also asking about the parameters that determine a competent immune system in fighting against the breast cancer.
So the sources for cancer in general, right? What triggers it? In medicine, we learn about the two hit theory for your risks of developing cancer in your lifetime. The first hit is a genetic predisposition, right? So some people, based on the genes they inherit, they are disposed to developing cancer at some point in your life, a certain type of cancer at some point in their life. However, that's just one hit, right? You need two hits for that cancer then to actually develop. And the second hit often is environmental factors and lifestyle and behavior, right? So let's say, for example, you have inherited a genetic marker to develop let's say pancreatic cancer or stomach cancer, right? It is not 100% guaranteed that you will develop pancreatic or stomach cancer, right? You may live your whole life without you developing that cancer. However, if the second hit occur, right, because of environmental factors or lifestyle, for example, exposure to certain toxins um, and behaviors like smoking, you know, nicotine is a toxin, especially to esophageal cancer, lung cancer, stomach cancers. Alcohol, heavy alcohol use, right, is considered a toxin. So when you have that second hit, now your chances of your cell turning into cancerous cells increases. In terms of the second question, really, I think you were asking about the location.
Oh, I was asking about the parameters that determine a competent immune system in fighting against, in fighting
Right.
against the breast cancer.
So it seems that our bodies, God created our bodies to fight, right? Every day fight against disease, fight against environmental stresses. The goal is for our survival, right? But in my opinion, we're not meant to live forever. So our bodies were programmed as well to die. And so, but we were given an immune system to be able to escape and fight against these abnormalities that are developing our bodies every day. For a good example will be somebody who has an immunodeficiency like HIV and AIDS. You do know that people who have HIV and develop AIDS because of lack of treatment or no treatment actually have increased risks compared to a person who has an intact immune system. So somebody who has an immunocompromised disease like HIV or AIDS has a higher risk of developing various type of cancers. There are cancers that you and I who have intact immune system will never develop. Certain skin cancers, right? But people who have HIV and propagate that into AIDS, actually they started noticing cancers in these patients that they had never seen before. So as I mentioned, our immune system are sort of prepped, and our immune systems have been developed to fight these very minimal or very minute changes that occurs in our bodies, and they're constantly getting rid of cancerous cells. But immunodeficiency and immunosuppression can definitely increase your risk because your immune system has been weakened and are no longer able to stop these cancer cells or getting rid of them from the body.
Okay, thank you very much.
Mhm.
We're receiving questions here from the audience. I think Madam Amina Zuleika is asking, how can one do self-examination?
So for a woman, the way we were trained in medical school and in residency is number one, you lift your arm above your head and you're gonna lay down flat or supine, okay? And you're gonna use just 4 fingers or even just maybe 3 of your fingers. And you're going to start, just think of your breast, right, as like a circular regions, right? And you start from top and you go all around in circles, all the way, and you end at the center, which is the areola, right? You do that, and you even go up towards the armpit because breast tissue can extend towards the armpit, right? You're really just feeling for consistency. The breast tissue should be consistent, right? If you feel like a bump or a lump, we'll call it, in any area, notify your primary care doctor. If that is changing especially so most of the benign masses in the breast are sometimes painful, like the adenofibromas are painful to palpation, but for breast cancer, sometimes they're not palpable. These masses are very subtle, right? But just by doing that exam every month bilaterally can help you identify an irregularity in your breast tissue. So that's how we teach women to do self-breast examinations.
Okay. We also have a question here from Mohamed Ali Kagbo.
Mm-hmm.
It says, is interventional radiology procedures a better option than the usual mates ah, mas mastectomy or breast conversion lumpectomy? Is okay.
So for breast cancer treatment, there is what we consider the least invasive and the most invasive, right? So the least invasive for me would be lumpectomy, because you're going in, you're targeting the tumor itself. The tumor has to go. You have to take it out, because the reason why it's called a tumor, a malignant tumor, is because it has the ability, right, to spread and to shorten your lifespan. So it's considered as an alien in your body, and he has to go. It has to be removed. And the best way to do that is to remove it and target that treatment and removal to that specific area, and not having to expose your entire system, right, to the toxicity of chemotherapy, of radiation, right? So lumpectomy, which is just going in to remove the lump, which is really the cancerous lump, out of the system, close the wound. We often do that surgery when it's recognized early. We do it women under just light sedation, not even general anesthesia, right? The surgery could be like 30 minutes. Versus mastectomy, which is now the complete removal of, they're going after the entire breast tissue, because any breast tissue that's still present is still at risk of developing into cancer. The goal is to go in there, remove all breast tissue, again, to reduce your chances of any of them turning into cancer. That's invasive. It's 3-hour surgery. Lymph nodes are being removed. Um, Infection is a risk afterwards. It's a lot of pain. It's so painful, right? These women, thank God for anesthesiologists and pain medicine doctors. But I remember my English teacher in Bo, where I grew up. She developed breast cancer later on in her life. And because the surgery was done in Sierra Leone, it was a mastectomy that was done in Sierra Leone. Pain management post surgery was not good. And this lady spent the night on the floor screaming in pain, and by morning she was dead. That always is in my mind, right? And the lumpectomy would have been less painful for her versus the mastectomy. Now, in this country, we are better at treating, the pain from that type of surgery, but that's the surgery you don't want. The early screening, early detection decreases your chances of having to go that route. Radiation anywhere. You could be going to radiate the breast mass, but you're radiating other tissues around. And then when you radiate healthy tissue, you increase their chances of developing into cancer. So you radiate the chest area, guess what? Maybe the cancer was in one breast. Now that woman's chances of developing cancer in the contralateral or the other side of the breast increases. So is oncology, right? Chemotherapy. Chemotherapy is invasive. The treatment is going into your blood system. Every organ system that receives that blood supply is getting exposed to that medication. So it's called, for me, it's a higher level of invasiveness versus the lumpectomy.
Okay, thank you very much. And we have a question here from Abdul Karim Williams. It reads, As an esteemed doctor who has witnessed firsthand the psychological impact breast cancer has created in the victims, what do you recommend the government of Sierra Leone or concerned organizations in Sierra Leone to do for survivors to ease the psychological burden of the victims?
I wouldn't, so this responsibility is not only on the government, right? It's a citizen cause. All of us, especially the medical profession, right? But women's organization and everything else, because people are more likely to feel comfortable discussing breast and breast health in a forum of women, right? I'm sorry about the men, but really, in that type of setting, in that type of circle, versus in a more national stage, whatever is happening. Um, Organizations that bring the, like take up this emblem of awareness, and bring it to Sierra Leone, right? They can create that incentive for the government to jump on board and to create funding, right? So if you have a group of medical doctors who are wanting to then sort of need funding for mammography, it's expensive, right? Most women in Sierra Leone will not be able to afford it. But if the government, one way the government can really help is to either subsidize the cost of it, right? Or get rid of, take care of the entire cost for any woman that needs to have that screening done. And they can do that by appealing to and applying for grants from these other big companies abroad who want to see the survival rate of breast cancer globally go down. So the government can come in to apply for those grants and funding and then make that treatment modality, that diagnostic modality available at a cheaper rate or even for free for the women in Sierra Leone. But I think ultimately the real responsibility lies within the citizens and the medical community.
Okay. Thank you very much. And we also have a question from Amina Zulaika, and it says, what are the chances of reoccurrence of breast cancer after the initial diagnosis and cure?
It depends, it depends on the stage of diagnosis, right? Breast cancer diagnosed at stage 1, meaning the cancer is just at that specific location in the breast. It has not gone beyond the breast. It has not invaded the lymph node. So staging of breast cancer, let me just go over this briefly. There are 4 stages really of breast cancer, and then obviously each stage is broken down as you go higher up. But for simplicity's sake, the 4 stages of breast cancer, stage 1 is a better stage. That means the cancer is diagnosed at a specific location, which is the breast tissue. It has not invaded the surrounding lymph nodes. Lymph nodes are the main route for cancer cells to propagate themselves and invade other organs and tissues, right? You don't want that, because the moment it happens, now it becomes a race. Now you're not just having to manage one organ, now you have to go after other organs, right? So breast surgery is much more simple than having to now do lung surgery to remove those cancer cells, or brain surgery to remove those cancer cells. So you want it to stay put where it is. So that's stage 1. A woman that is diagnosed at stage 1, her chances of survival, especially the 5-year survival, is greater than 80%. Okay. Stage 2 means the cancer cell has managed to leave the breast tissue and has invaded the surrounding lymph node, the lymph nodes, especially the axillary lymph nodes under the armpit. Now they have identified them there, but not in any other organs in the body, right? So that's stage 2. That is still okay. And by removal and some chemotherapy, that woman's chance of survival is still higher versus stage 3 and stage 4. which is where a lot of our people in Africa, that's at the stage that they are diagnosed. Stage 3 just means that he has invaded another organ. Stage 4, he has invaded multiple organs. The treatment, the management is difficult, it's more complicated now, and hence the survival rate for that woman goes down significantly.
Okay, thank you very much. And I think early on in your presentation, you mentioned obesity. So that raised a particular question. Does bigger breast I mean, having bigger breast, is it a risk factor for breast cancer?
Definitely, yes. And not only because the more breast tissue you have, right, the more chances are that the continued, division, dividing, and replication of those tissues, the more chances of one of those cells, dividing abnormally and turning into a cancerous cell. But not only that, diagnosing, right, in terms of mammography and even the palpation becomes a little bit difficult. So some women with dense breast tissue or large breast tissue um, can actually have mammograms done and it's missed because the change, the tumor cells, sometimes the lump is so small that until it becomes larger, now at risk of developing to stage 2, that's when it's identified. Right? So that's why obesity is one of the risk factors for breast cancer. Yeah.
Okay, thank you very much. We also have a question here from Mr. Karimu. It says, what are the direct consequences of breast cancer in women of reproductive ages? In other words, what are some of the post-treatment effects of women in their reproductive ages versus, I think it's not completed, but basically she's just trying to ask the consequences of breast cancer in women of reproductive ages and the post-treatment effects in these women.
So the good news is, even though breast cancer can be diagnosed in women in reproductive years, that incidence is lower versus postmenopausal women. Most women are being diagnosed with breast cancer after they've had their children, right? Most often it's in the age of upper 40s and 50s and 60s, right? So most women have had children in their 20s or in their 30s. But for the woman who is diagnosed in her reproductive years, oftentimes it's because of family history of the BRCA gene mutation, right? And you have, once that gene is identified in your family member, you make a choice. But you still have options. The choice is often so if they do a mastectomy, right, you still have your reproductive organs. You may not breastfeed your child, right? But you can still carry your child because your uterus and your ovaries are intact. But for women who have the history of BRCA gene mutation in their family members, right, the prophylactic treatment is hysterectomy and mastectomy, and then going on the estrogen receptor blockers like tamoxifen, which throws them into early menopause. And so if you have not had children by the time of that diagnosis, obviously, if you don't have a uterus or you're not going to, carry a child. Now, because of modern medicine, obviously, now if a woman really wants to have a child, there are so many options to do it. You could have a surrogate, right? You can have your eggs frozen for years to come and then have somebody else carry that child for you. But sometimes the morbidity of going into early menopause, right, having to be on this endocrine receptor blockers is tough. The side effects, are not easy, right, for those women. But if a woman, let's say at 35, is diagnosed with breast cancer and she just needs a lumpectomy, she has breast tissue still, she can continue to breastfeed. She still has a uterus, she can get pregnant and carry the child to term. right? But for those women who are having to remove their uterus because of the BRCA gene mutation, most of the times physicians will advise them, why don't you finish having your children, right, first? And we will look at the age when the first family member was diagnosed. So let's say your mother was diagnosed at 42. Let's target to remove those at-risk organs before the age of 42. So for example, Angelina Jolie, even though she's still in reproductive years, she had already had her children, and she was able to easily make that decision to have her uterus removed and still continue on because she had already, had children and was not planning to have any more children.
Okay, thank you very much. We have a question also here from Emmanuel Levy. Okay, it says, does that mean female patients undergoing hormonal therapy, such as estrogen inhibitors, cannot conceive due to the fact that estrogen plays a big role in ovulation and preparing the uterus for conception?
Yes, that is true. Once you start modulating, right, the hormones that are very much involved in reproduction, right, whether you're blocking estrogen or progesterone, then you're interfering with the reproductive system and the chances of that woman conceiving and reproducing. So, like I mentioned before, the most common drug among these is the tamoxifen, which is a estrogen receptor blocker. And most women, majority of women who end up going on that medication, go into early menopause.
And we have a concern here also. This person is saying the male breast cannot fit between the plates of a mammogram. So is self-examination the only option for early diagnosis in males?
Yes. As a male, as you guys know, some men have the muscular chest, right? It's all muscle, and it's flat. But there are men who start developing, you know, um, breast tissue, right, early on, and those men are even at higher risk. So, and it may be due to testosterone levels, going down in these men. But those men are advised and they're supposed to be really taught by their primary care doctor how to do self breast examinations on a monthly basis. And if
Okay.
they identify anything that is abnormal, to go in and have a mammogram and then biopsy.
Okay, we have another question here. This person is trying to ask, trying to know if breastfeeding makes it less likely of getting the breast cancer disease.
No, that's another myth. Not at all. Like I said, for all of us, mostly women who have breast tissue, we're all at risk for developing breast cancer. So first, so we have that first hit, right, that I mentioned and I talked about before. Now, certain lifestyle behaviors, risky behaviors, can put us at risk for having that second hit. But breastfeeding has not been identified as part of that second hit risk factor. Um, we have had women who have never had children develop breast cancer. There are certain identified risk factors, and for example, women and girls who start menstruating at an early age, like age 12, 10, 11, right? Their chances of developing breast cancer is higher. Women who go into menopause later, their chances of also developing breast cancer, they're seeing that it's higher, but not women who breastfeed versus women who do not breastfeed.
Okay. And you can see, Okay, Emmanuel, maybe says in Russia we do chest X-rays at the start of the school year. I think he's trying to talk about general radiation, and the exposure to radiation in upper chest areas can increase the chances of breast cancer. Is there a safer duration?
In terms of radiation, upper chest radiation and the risks of developing breast cancer?
Yeah, I think so.
Yes, and that's for every, cancer, right? Somebody may have pancreatic cancer and they have to irradiate the upper abdomen. By doing so, they have also placed that patient at risk of developing other types of abdominal cancer. So it's the same thing with the chest. If you're going to irradiate the entire chest, you're not put that woman at risk for developing cancer, breast cancer in the contralateral breast. So one of the improvement in medicine that we're seeing now is that this radiation are becoming more targeted. So before, when they had no choice but to radiate the entire chest area, now there are radiation approaches wherein they're targeting specifically the area of the cancer occurrence, this is really good news, right? Because then other healthy tissues are now less likely to be damaged and to propagate into cancerous cells later on. But radiation itself is never good. It's just really there to improve your survival. However, with early detection, early stage detection, we don't often see women having to go through radiation for breast cancer treatment.
Okay, and we have a comment here from Cinema Monde. It says, thank you, Dr. Bundu, for the informative presentation. I learned a couple of new information. Mine is a comment. From my personal experience in Sierra Leone, I find that in spite of the breast cancer awareness program, government not integrated proper screening in female groups, clinical breast examination, but less so for mammography. If the least uneducated woman who can facilitate knows that part of a program to a mammogram, at least at a discounted rate to really help. I believe that should be the focus of groups that promote breast awareness and
I think Ishmael's screen is frozen. Can the person who asked the question, can you speak up and maybe Ishmael?
yeah, I think
Sorry,
there
your
was
screen
a
was
problem.
frozen briefly.
Okay, yeah. Sorry about that. I think continue uh awareness do the on the public health program. I think this
Requires teaching for self-examinations, but not only that, screening requires mammography. The reason why developing countries have been so good and have seen so much success in early detection and treatment is because of mammography. That cannot be underrated. And if this is going to be right a way and an approach to curbing breast cancer, deaths, then the government in every country has to put funding and effort in making it available to the population, whether it's available at a lower cost or available for free. But mammography is an emblem for awareness because it's part of that also important screening process.
Thank you very much, Dr. Bundo. I think next in our agenda is the closing remarks.
Mhm.
So I think we finally come to the end of this presentation. In summary, breast cancer, as we all know, remains the most lethal malignancy among women worldwide. And over the decades, the incidence of breast cancer has increased, but thanks to the modern technologies in diagnosis and treatment, there has been a consistent decrease in the mortality. So advice to you all out there, especially the ladies, will say be very observant, you know, and the moment you notice any lump or changes in your breast region, make it a point of duty to see a specialist or go for breast screening to stay on the safer side at least, you know. We would like to extend sincere thanks and appreciation again to able guest speaker, Dr. Kadia Bundu, for the wonderful presentation. And we hope that someday in the near future, we'll be able to invite you here in Russia, hopefully during possibly a convention to give us talks on other topics, probably TED Talks or even career insights and all. So once again, I want to thank you, Dr. Kadir. And more especially, I also want to thank our esteemed audience for your presence and active participation. So hopefully this presentation will be beneficial for all of us that are present here. And as we all noticed, this session has been recorded and will be uploaded to our various social media handles. So we'll encourage each and every one of you to, join or follow most of our social media handles to get acquainted more with the NUSS Student Union Organization and to know about activities, you know, from time to time. So I think this will be the end of our presentation. And once again, thank you very much, Dr. Bundo. We really appreciate your presence and we wish you all the best in all your endeavors. So thank you very much.
Thank you and have a good night.
Thank you.
Thank you.